Hello all. Are you dealing with recurrent infection around your fingernails or toenails? This condition is called, by the way, paronychia. Well, stay tuned with the video because I'll be explaining what paronychia is. I'll be explaining about homeopathic management and then ultimately tell you what to do if you have this infection. Well, friends, hello to all. This is Dr. Veena, and you're watching my YouTube channel, Dr. Veena, your homeopath. Well, today's topic, as I explained, is about paronychia. Well, friends, paronychia is a condition where there is inflammation around the nail, that is, around this nail folds. It can be, your fingers or it can be your toes. That is called paronychia. Now, let's find out who all are at high risk. Now, irritants or any trauma, it causes cuticle disruption. And when there is cuticle disruption, the chances of infection will be more. Now, friends, irritants like, for example, detergent, people who are, working with detergent without using any protective layer like gloves, they might, the chances of having paronychia will be more. People who are more in contact with water also, it has been seen, infection chances of the infection is again more. For example, people who are bartenders or housemaids or even housewives, main activity is, they are more indulged in water while washing the utensils or doing their dishes or doing their laundries. Well, friends, one more thing, like people, those who have these habits of chewing their nails, biting their nails, or even sucking thumbs, it causes cuticle disruption. Again, these kind of activities lead to, prone to infections. Well, people who they cut their nails very short, or doing pedicure or manicure frequently, and in doing these pedicure manicure, the instrument which is being used and is not at all sanitized properly, so there again chances will be high. uh, Again, those who have, they already have nail infections like ingrowing nails, or they have fungal infection of the nails, or any skin condition where it is chapped or dryness is there around the nail, fingertips or toe tips, again the chances will be high. Now, what are the symptoms of paronychia? Well, it is an inflammation. So in inflammation, there will be redness around, there will be little swelling will be there, tenderness will be there, maybe pain will be there, and there will be some pus discharge or serious fluid collection will be there, or even pus formation will be there. So having been known all this thing, we should know there are two types of paronychia. Well, it can be acute paronychia according to the duration, and in acute condition, normally it is caused due to bacteria. Streptococcus, pyogenes, or Staphylococcus aureus is the main cause, and it can be chronic or it can be a recurrent kind of paronychia. And in recurrent, it is actually super aided infection on these bacterial infection, that is by fungal infection called Candida. So these are the basic causes of paronychia. Now, after knowing all this, what is paronychia, what are the, who all are at high risk, what are the, main symptoms, and what are the causes. Now, let's see what is its homeopathic treatment. There are many medicine, but I will be explaining the top-notch medicines for paronychia. The first medicine, which is really very good, is Silesia. Well, Silesia is a medicine which is given whenever there is any smallest of injury causes, suppuration. Like if a person is there, the prick caused this infection, and it is leading to suppuration, there you can use Silesia. Or any condition where there is nail condition where there is suppuration and there is tendency that this will go into suppuration, there you can use Silesia. Now, similar to this medicine, there is another medicine that is called Hepar Sulph. In Hepar Sulph also, tendency of suppuration is more, and there is very, very important characteristic. There is lot of tenderness, very oversensitive to pain. The person is very, very oversensitive to pain. So in these conditions, Hepar Sulph is the remedy. Now, when you see the nails of toenails or fingernails of this person, and it is not healthy. The nails are not healthy, they are crippled, they are not normal, they are thick, they are brownish yellowish in nature, edges, ridges are there. In these kind of persons who have, along with that, paronychia is there, fungal infection is there in the nail beds, and along with that paronychia is there, the medicine is Antim Crud. Antim Crud is a very wonderful medicine whenever there is any condition or involving around the nails. The medicine is Antim Crud. Next medicine is graphitis. In graphitis also, any smallest of injury can cause or can lead to suppuration. It helps to resolve this suppuration. Along with that, if around the nails there is dryness we see, there we can use graphitis. And one more, the last but not least, very important medicine, that is a medicine which is used, which is made from neem, as a directa indica. In as a directa indica, this medicine, it comes in form of ointment also. So this ointment, if you apply over this affected part, and especially in chronic cases, it is really beneficial. It helps in resolving this fungal infection as well as this paronychia, the around the nails. If it is there, it can resolve both onychia as well as paronychia. Onychia is the fungal infection of the nail, and paronychia is around the nail. The nail folds are inflamed. So these are the medicine. There are many more medicines, well, anthraxinum, fluoric acid, arsenic album, and many more medicine can be given according to the signs and symptoms of the patient. But these were the very important, top-notch medicines of for used for paronychia. Now let's come to the third session of this discussion, that is, if you have paronychia, what to do. Well friends, if you have paronychia and the cause, or the triggering factor is the irritants, like as I said, detergent, it can be a cause, it can be more contact with the water, so you have to protect your fingers. So for that, use gloves. Gloves has to be used while washing clothes or doing your laundries. That is very important. Then habits like chewing or clipping your nails too much, it should be very much reduced. You have to see that if your activity is such, you have to restrain from these activities. Next is, whenever going for pedicure or manicure, you need to understand that it shouldn't be so frequent, and secondly, this, it should be sanitized, the instrument should be sanitized, that you have to make sure. And finally, if you have recurrent pains, or there is inflammation, acute inflammation, or if you, even if it is recurrent chronic kind, you can put your fingers or your toes in bucket of lukewarm water, put there for few minutes, and you can put just 1 tablespoon of table salt, as well as, all if you have Epsom salt, that is also really very beneficial to curb the pain. Now saying this, let me conclude that paronychia is a very common condition, and it's very irritating as well, as because draining the pus, recurrent, or the fungal condition of the nails, the crippling condition, is really very kind of embarrassing also, and troublesome also. So homeopathy is the solution for it. Well, saying this, if you like this, like my whole video, the knowledge which I give you through my videos, if you like it, please like my video and comment it, subscribe it, and yes, hit the bell icon. For more videos, please follow my channel. Till then, goodbye and thank you from